guys, and welcome. Thanks so much for joining me.
Thanks for having me.
So I'm really excited. Today we're going to be chatting about cupping, which is a super cool kind of new topic that's come around, a newish modality that we're starting to use in horses, which is exciting and has really exciting possibilities. So if you guys are joining us live, it's great to have you. Please feel free to join in the conversation. We want to hear from you. Ask your questions. We're here to answer them and discuss them. If you have any thoughts or theories, share those with us as well. We're all here to learn. So let's jump right in. We already have a few people live with us. Please introduce yourself and let us know who you are and what you do.
Well, thank you again for having me. I always enjoy being a part of what you guys are doing. It's awesome. So I'm Ciara Crawford. I am the owner of Sozo Equine, and I am an occupational therapist. I am a massage therapist. I own Sozo, and then I teach. And so I teach on kinesiology taping. I teach on cupping. I teach on fascia blading. And so I really love fascia in the nervous system, which is kind of like saying I love strawberries and red, right? Like you can't separate the two. It just is what it is. So I really love taking the human practice and the horse practice and seeing a lot of times we're missing something from one of them. Like we're doing something in horses we're not doing in humans. We're doing something in humans we're not doing in horses. And so it's really fun to combine those. I love teaching. I've met so many amazing, brilliant people that have taught me so much through teaching. And so I think that's how we found each other. Maybe it was just the social media world anyways, but yeah, I love it. It's really awesome. So I spend most of my time either treating a horse or teaching people how to treat horses, and I love it.
I really love that you said you kind of combine what is happening in the human industry with what we do in horses, because I think that combined perspective is so valuable. And even if you as an individual, so me for example, know nothing about people, but like having that conversation with a human physiotherapist and saying, well, what would you do in this scenario? How would you work with that? There is so much we can learn from taking a different perspective and a different kind of viewpoint. And in our, in the equine industry as well, when we speak to feet people versus saddle people versus bridle people, like there's just so much we can learn when we come from a different perspective. I just want to say welcome to everyone who's joining us live. It's so great to have you. We are really here to have a conversation with you. So let us know where you're from. And if you use cupping as a modality, we're chatting about cupping today, cupping therapy and equines. Any questions, any comments, any theories, please share them with us. We would love to engage with you and just have a conversation with you guys. That is why we're here. All right, so let's jump into cupping. When did you start using that as a modality in horses, and why?
So I don't remember when I started using it. It was a couple years ago, maybe 3-ish or 4 years ago, and I was using it on people and had never seen it used on horses, and so I thought, why not? My philosophy is like, if I do no harm and I learn something, then let's just try it. So I'm always willing to just try something and see what happens. So specifically, like one of those missing pieces that I feel like in the equine world that is very normal in the human world is assessing the peripheral nervous system. So it's not very common in horses for us to look at a horse with their hind leg with internal rotation and say, maybe there's an obturator nerve restriction, or to look at a horse leaning toe first on the front and say, maybe there's a median nerve restriction. And so that is so common in human practice. Like we're always assessing the peripheral nervous system. And what I was doing is treating that with cupping. And so I would put the cups on the soft tissue where there was a restriction in that nerve. And then whenever we would do our nerve glides and our manipulation, the cups would be on the primary restriction. So I thought, let's try this on horses. And so I did. And I played with that a lot. And I just tinkered with it to see how it would stick to them, first of all, because it wasn't easy to get it to stick to them. And then just seeing how they responded to it, seeing how they moved with it, because I prefer the horse to moving the cups on. So I just started playing with it. So why? I don't know. I thought it was cool and maybe we could do something with it. And I don't use it near as much as I use taping, just because it's messy and it's cold and it doesn't always stick on long hair. So if you're, if it's wintertime or if you're in an area where you have longer hair for longer times of the year, it is much more difficult. but I really, really love it when it's indicated. It's almost like, you know, if my hands are not effective, if the tape's not effective and I need to send in the big troops, that's whenever I will send in the cups. And a lot of times when we say cupping, sometimes depending on where you are in the world, people will think of like glass and fire and slitting skin open. And so slitting skin open is called wet cupping. But if you're not using any body fluids and you're just using a silicone cup on the skin, that's called dry cupping. And so that's what I do. I do dry cupping with the silicone cupping. And it's also called myofascial decompression. So started playing with it, seeing a lot of cool things with it. And people were fascinated by it. So eventually I built a class and started teaching on it. And like I said, learning even more from my students and seeing what they're doing with it is really awesome too.
Awesome. I love that. I think, yeah, you hit on something there. It's interesting and it looks cool. I think we all love, you know, new toys and interesting toys.
Yeah.
But I think in this case, the thing that keeps grabbing me with cupping is that we're getting that decompression. And it is it's a brilliant decompression. It's not like we're getting a little bit of decompression with taping. We're getting decompression when we put a cup on. So I really like that. Welcome to everyone who's joined us. We've had a few more people jump on live. It's really great to have you. Please join the conversation. Share any thoughts or theories or questions that you have. We're really here to chat with you guys. So let's talk about, the other thing that you said that I love is that you were using it for neural restrictions. I really like that. That's really cool. We have an amazing webinar in the small animal platform that looks at neurodynamics and mobilizing those peripheral nerves when there are restrictions there. And I found applying those techniques to my equine patients so valuable, because you're right, we don't evaluate the nerves and how they're gliding and how much mobility there is in that, along that line of the nerve enough. We're not thinking about it. We're thinking about the other things when we're evaluating where the limb is going and how the tissues are feeling. We're not thinking about the nerves. So I like that that's what you were using it for initially. I think that's a really great use for it.
I'll have on the dashboard.
Yeah. Okay, so we have a question here actually before I ask my next one from Amanda. Hi Amanda, it's really great to have you. I'm watching from Wichita, Kansas. Nice. It's great to have you. I'm an equine massage therapist as well as a human massage therapist. I've done cupping on both. Awesome. However, I haven't been successful on getting it to stick on the horse. I've tried getting the silicone cups wet. I've also tried ultrasound gel. How do I get it to stay? All right.
You're pretty
there.
Sorry. So we're neighbors. I use tons of ultrasound gel. Like when you think there's enough, use more. It's almost like this sloppy, goopy mess. It does have to be a lot because it has to get in between every single hair so that you can create a full seal around the lip. So like I said, you're in Kansas, so we have similar weather. I have a lot of success up until about November. And then kind of December, January, February, March, their hair is really, really too fluffy. I can get a seal if I really have to, but it's not going to last very long. It's going to be about 5 seconds. I know some people use flour. I have never needed to use flour, but I know some people say they'll mix either flour and water or flour and ultrasound gel and create kind of a soupy texture and rub that in. I've never done that. I've heard a lot of success with it. So I just always say when you think you have enough ultrasound gel, you don't. Add a bunch more, and it's a big mess to clean up. I've done it in the rain, and as long as it's a short summer coat, I've literally just, if it rains, I'll go out and cut my horses so that I don't waste any ultrasound gel, and I'll use their wetness from the rain, and it works great for me. Also, it depends on what cups you're using. I have only had success with rock pods from Rock Tape. So I think I should have brought one in here with me, but they have a ginormous lip, probably like 1/2 inch that goes all the way around the cup. And I think that you need that much surface area to create that section. I've ordered a ton from Amazon just to try them so that I can tell students if they work or not. And they all have really thin lips. And that's all I can think of that would be the difference as to why the Rock Pods work so much better. I use Rock Pods XL on soft tissue pretty much, and then I use their normal size, just Rock Pods, if I'm doing down on the lower legs or flexor tendons or hocks or anything like that. So the cups you're using might be a problem too, Amanda.
Okay. I like that. Wet the coat first and then add ultrasound gel.
Yeah.
That would be, yeah. Then you're getting both of those benefits. I love that. Keep using more ultrasound gel. That's the worst. That's the worst. I swear it's why I veer away from a lot of my electrotherapy modalities because I'm just like gross.
Yeah.
Gross.
Yeah. And then you want to use tape afterwards. You have to.
You can't. Yeah.
Really, lots of elbow grease. Yeah.
Exactly. Fair enough. Yeah. Okay. Great. So let's talk a little bit about how cupping works and why it works and what the effect is on the tissue.
Yeah, so like you said, it creates that suction. It creates that negative pressure, which we can't really create any other way. So taping is negative pressure, but it's not near as intense or as aggressive as the cupping. And so mechanically, it is breaking up those adhesions and it's creating more space. So if a horse is stepping on a water hose, you're not going to get good flow of water coming out the end of that hose. But then if you decompress it by moving that horse's hoof off of the water hose, you'll have much better flow. And so a lot of times when we have scar tissue or fibrosis of any kind, it will get tangled up around a vessel and it'll tighten down on that vessel, whether that's a nerve, a lymphatic vessel, a blood vessel, or anything like that. So just simply mechanically decompressing whatever is restricting those vessels is really effective. Like I said, I always go back to the nervous system. We know so much in the human world about how effective touch is for rehab, because oftentimes the brain will disassociate. If the pain's bad enough, the brain just turns off connection to that part of the body and says, I don't want to know it's there. It hurts too bad. Mm-hmm. So simply touching it, the effect of the touch from the cup, the mechanical decompression. And then what's really, really cool about cupping is it creates a chemical response in the tissue. So anytime there's any soft tissue damage, even if it's micro tears just from a normal workout, the body will create free heme. So free heme is bad. If it stays in the tissue and nothing's done to it, it will start to turn into fibrosis. It will start to turn into scar tissue and it'll be really restrictive. So free heme's bad. Negative skin strain from the cupping creates heme oxygenase. So basically the heme oxygenase comes in and gobbles up the free heme, metabolizes it into a way that the body can process that. So if we have this continued free heme, it eventually gets thicker and more restrictive and nasty. And then the negative skin strain creates the heme oxygenase that comes in, eats the free heme, and then the tissue stays soft. We have less restrictions. And so a lot of times when people say there's bruising after cupping, it's that catabolic process where actually the free heme's eating up, the heme oxygenase is eating up the free heme. And so depending on if you turn really purple or sometimes green or sometimes brown, that's actually that chemical process happening in the tissue, depending on what your body needs that free heme to do. So free heme's not always bad. It's not always alarming just because it's present, because it's a natural part of the process. But if we don't do something with it and the body's not able to use it, it is bad whenever it builds up. So that's one of my favorite things about cupping. There really is no other modality that's able to create that same effect. And so that's pretty darn cool to me.
Okay. I think let's talk a little bit about the bruising.
Yeah.
Because I think that's a big, I would say, alarm bell for a lot of people, right? They do not want to, we don't want to cause any harm. It's not like a person who's choosing to have this modality apply to them, and the horse can't say, oh my gosh, I'm so sore the next day. And of course we don't necessarily want them to be
Sure.
sore after a treatment. So are you using the cupping like in humans to still get that bruising effect, or are you not using it to that degree, not getting bruising and having more of a mechanical effect?
So my goal is never bruising. Even in humans, I try to avoid bruising. If it happens, it happens. But I am never going to leave that cup on there and then pull it off and be like, oh, look how bubbled up it is. And look, it's already purple. Like, that's never a goal. Even though it's a positive thing that the body's creating that chemical process, just like anything else, less is more, right? Like, we want to do the least amount to the body to let it heal itself. And so with horses, I only do it in 30-minute or 30-second segments. So I will put the cup on, not 30 minutes, 30 seconds. And of course, I'm always reading the horse. My eyes are always on their eyes, on their ears, on their mouth, watching to see any reaction that they would give me, any normal pain reaction. Sometimes when you put a cup on, they move away from you, just the standard, physical. If it's on their back, they'll kind of, oh, so then I'm not going to be as aggressive with that. So there's 3 different ways you can put the cups on, and there are 3 different levels of aggressive suction. So I always start with the lightest one, which is where you put the cup on the surface and then plunge the top in. That's going to be aggressive. I start with that, and I ask them to move with the cup on. So as long as they're moving comfortably, they're not moving away from the cup, I will do that for about 15 seconds. Then I'll stop them. Then I'll put the cup back on and I will move the cup. So I'll plunge and I'll move and I'll plunge and I'll move. So more of like a massage technique. If at any point they ever tell me this is really, really hurting, of course they might react to it. But if they tell me this is really, really hurting, I won't continue. And I'll never treat one spot for more than 60 seconds. So let's say I put the cup on there. I ask them to move. Let's say it's a hamstring. I ask them to walk for about 15 seconds. Then I'm going to do that cupping massage, and then we're done. If they need more, in 3 days, that's fine. But it's hard because they have a coat and we can't see if we are creating too much tissue change. And so again, always listen to them. The next day you go out there, you palpate, you make sure they're not palpating significantly sorer than you would expect them to be. They might have a little soreness like we do after body work, but you do not want any significant reactions from them. So we don't really have their skin color to check, but we have our basic horsemanship skills where we can see how much pain they're in, and we always listen to them.
I like that. I think all the people that I've spoken to about this have said similar, you really want to use it for very short durations. So not like in people where it's staying on for minutes, you're staying on for seconds. So I like that. And if you're using it moving, so are you just walking the horse forward, moving them around?
For somebody else to be leading them. And it depends. So if I am doing a nerve glide, I will move that horse's leg through a nerve glide with the cups on the nerves. And yeah, if I'm asking them to walk like on a hamstring, usually I'll put 3, usually it's the base, usually it's the insertion of the hamstring that really needs it. And so down on that lower part, I'll put 3 cups, and then I'll ask them to walk like 1 circle on a lunge line or something. And I like to go both directions if they can tolerate it, just to get a little bit different torque on that hamstring. Sometimes if, like I said, if I'm doing a nerve glide on that back leg, then I would be moving their leg for them. And that would be about 15 seconds as well.
Okay. And would you also kind of use some let me rephrase that, use movements that are targeting a fascial line or fascial chain so that you're kind of,
Yeah, for sure. So,
side movement on the other side kind of thing?
Yeah. So yeah, if you have a restriction from a bad saddle fit, that's going to affect your hamstring, right? And so sometimes I'll space out my cups and I'll put 1 on the wither, 1 on the lumbar, and 1 on the hamstring. And then I'll ask them to walk, or I will bring that hind leg into flexion. But yeah, I like addressing fascial lines as well, because we know if there's a restriction at one point, there's a restriction on the entire line. So that's a good point to bring up too.
I like that. That's what I've been playing with my cups, is trying to figure out those connections in the lines and how I can influence this area with that area. And that's what I'm having fun with at the moment.
It's really fun to look at a whole line and go, okay, now problem. Like let's find the weak link and then let's correct it. So it's fun.
So let's talk about some contraindications for cupping. When would we not use it?
So basically, you never want to use it if there's compromised skin. You want the skin to be nice, thick, normal, and healthy. Even though it is great for breaking up scar tissue, you want it to be a pretty mature scar. You want it to be at least 4 to 6 months out. So I would use blading before then, and I would use tape, but I wouldn't use the aggression of cupping until you're about 4 to 6 months out, depending on where it's at and depending on how mature that scar is. Which horses aren't really on blood thinners, but if they're on any kind of medication that would be thinning their blood, you don't ever want to bring extra blood to the surface. You don't want to do it over wounds. You don't want to do it over anything that's open. There's not a lot of contraindications. Like I said, it can be too aggressive. It's one of those modalities because of the nature of its aggression, of the negative skin strain. There are times that it's just not indicated for a horse because maybe they're older and fragile and sensitive, and it's just not indicated for them. But there's not a lot of contraindications, really.
Okay. And what is your kind of ideal patient that you would be using this for, or ideal indications, maybe?
So, like I said, any sort of restrictions, fascial restrictions, which I know that's really broad, but when we think about how many restrictions can be in the body, and I said they could be affecting the lymphatic system, they could be affecting the blood flow, the nerve, the actual muscles being able to glide on each other. The primary indication in the research that's actually been researched is trigger points and increased range of motion. And most of that research has been done on the traps in humans, just because I think that's most accessible and easiest to check. And so the research shows that it's great at improving pain and improving range of motion, especially in the neck. And so we know that it is improving those restrictions. And again, like I said, it sounds oversimplified, but there's so many things in the body that are stuck because of the fascial restrictions, the fibrosis that's built up there. And so it's really, really effective. It's, like I said, it can be intense, but it's really effective for breaking up the stubborn areas.
Okay. And are there kind of temperaments that you would, so for example, if you have a horse that doesn't enjoy being touched, would you use cupping on that? Or is there something else that you would prefer to do?
So my first line of defense is always my hands, my bare hands. And then second for me personally is tape, because it's very non-aggressive. But it's crazy to me how sometimes a horse that doesn't like light touch likes the intense touch. And so again, you just always listen to the horse. There's been several that I'm like, they're probably not going to like this, but I feel like they need it. So let's give it a shot. You know, you always have that intuition as a therapist where you're like, this feels right to me. Let's do it. And so I've been really amazed that there are some horses that seem like they're so sensitive and they're even emotionally uncomfortable with touch, and the tape bothers them, and you put cup on them and they just like drop their head and relax. And they're like, that feels amazing. So it makes me wonder again, was that nerve so restricted that it was on fire, and then we decompressed it and they were like, thank you so much. I don't know. Typically the common response is to go to a really agreeable horse. But some of my most amazing cases were those horses that you thought, don't put a cup on them, and then you do, and they love it. So
I'm always interested in that behavioral aspect, because I think there's just so much for us to learn when we listen to our horses. And like you say, there is so much of an intuitive feel as well. We love to be science-based. We love to have evidence for what we're doing, but we're still working with a living animal that's an individual and that has an opinion that, you know, isn't in a journal. Thank you very much. So
if we'll listen, they're great communicators.
So amazing. I always, as a student, I actually I always tend towards the science side, and that was easy for me. The academic side is easy for me. But we had one instructor who was very, well, I want to say she was very woo-woo, touchy-feely. You know, half the time I was like, what are you even doing? And she always had the best results, and it drove me insane. And at one point I was just like, I'm done. I'm going to stop thinking, and I'm just going to do what you do. Just do that now.
Yeah.
And that combination, we have to just sometimes be guided by feel, and the science and the knowledge will feed into that. It's not like it goes away. It will still balance it out. As much as we don't want to be woo-woo and out there.
People in the human world that I kind of have to blame for yeah, my change, like you were talking about, and my love for the peripheral nervous system. And Allison Taylor is an occupational therapist that does amazing things on the arms, and she's always doing things that there's no evidence for. And people are like, "Where's the article?" And she's like, "I've changed 10 lives this week doing this." I like, like maybe there's not an article yet, but it's amazing. And then Anna Hartman, her company is Movement Rev, but she's brilliant with peripheral nerve. She's just doing amazing things, and she works with professional athletes. And anyways, if anybody's interested in those two categories from the human perspective, Allison Taylor and Anna Hartman are, again, brilliant. They don't stick to the research. They do what works, and it's really incredible.
We've got to have a questioning mind, try new things, figure it out. I love that.
Yeah.
And learn from each other. If we're not learning from each other, we're going to just stay stuck in one thing that works for us. We could be doing better.
Yeah, exactly.
So guys, any other questions or comments from your side, please share them. This is really, I think, one of my favorite subjects at the moment, because it's just so open. It's so open for us to try and play with and investigate. I love that you've mentioned that you've tried a bunch of different cups. I've tried these ones. This is all I can get in South Africa, here with a.
Are they glass? Oh, yeah.
No, it's not glass. It's plastic.
Gotcha.
So it's a hard plastic, which is still not ideal, because if they step on it, it will definitely break. But it won't shatter like glass. It's not. They're not great. But I can play with them a little bit. I was hoping rock pods.
Mm-hmm.
I was hoping they would have a stand at the IVRPT conference, so I could come home with some.
There was South Africa brand rock tape. Did I make that up? Is there not one? That needs to happen. Yeah.
If there is, then I am missing something.
I'm sure you would know about it. You would know much better than me.
Not necessarily. I don't know everything.
That's unfortunate, because that truly is the only cup I've found seal. So, but if yours is creating a seal, I'm glad it's working.
It's creating a seal 60% of the time. So I can't use it all over the body. There are different sizes, so I have a few different options, right? And obviously, like on the back and on the flatter areas, it's working. But if I can't add too much movement, I can't walk them. It'll come right off if I walk. So I can use just smaller mobilizations or movement. So that's partially why I'm going cup here, mobilize there. So cup around the pole, then work with the shoulder and the leg and get some mobility there, so that I'm moving a bit away, but still in that connection and chain, playing with that. I haven't tried the flour because, again, gross.
I feel like it's just like a roux, like a roux to start making soup, and it's on the horse, and I haven't tried it. So
but to do that on a client's horse, can you imagine?
When you have like 4 towels with you to get it all off.
No, I couldn't do it. No, that's too gross for me.
It's good to hear you say that, because it is very limiting to not have the tools you want. Like you said, to be able to do that. Because a lot of times I'm kind of milking my cup as I'm moving it.
Yeah.
You don't have that freedom with all of the cups. So
No.
Rock Tape also has a vibrating cup coming out soon, which is it's a very interesting philosophy. So, sort of like the tactile sensation of vibration, but adding in cupping. So I haven't played with them yet, but cool concept.
That is very interesting. Stuff to keep our eyes on. I like it.
Yeah.
I like it. I think there's definitely more for us to talk about in terms of neural assessment, glide, treatment, movement. So maybe that's the next topic we should dive into. From our audience, if you guys have any requests, let us know, and we can plan that and schedule that in. I think, in the new year sometime.
Yeah.
That would be great.
Yeah.
All right, guys. Thank you so much for joining us. Do you have anything else to add, Ciara?
No, thanks for having me. Again, I love talking about things that we don't know a lot about yet. And so it's very cool. I do have a class if anybody wants to reach out about a class, but it's very fun. I encourage you to play with it. See if it's something you even care to learn about before you invest in. But I think it's a great thing that has a lot of potential, especially when we look at the nervous system and the fascia.
For sure. Please do tell us a little bit more about Sozo, so that if people want to learn more from you, they can go there. Sorry, I forgot to ask that. Thanks for reminding me.
Yeah, so Sozo Equine LLC is where I am on Facebook. Sozo Equine _ is where I am on Instagram. And then Sozo Equine, you can find my classroom links on either one of those, or you can just shoot me a message. You can email me info@sozoequineinfo.com if you have any questions. But I would love to chat with you, love to talk about any questions or concerns you have. Actually, it's kind of funny. I don't know if people started seeing this being advertised, but I had so many cupping questions this week, and I don't normally have that many questions. And basically, people want to know, what does this do that no other modality, they're therapists. They're like, I already know how to, I'm already doing these 5 other modalities. What does cupping do for me that no other modality does? And it's really that negative skin strain, the chemical process of breaking up the free heme that nothing else is really able to do to that degree. So anyways, I'm rambling. You guys send me questions if you have any. And yeah, the class is available, and there's a lot of information in there. So thank you for having me again, Anne.
Absolutely. It's great having you. Guys, in November is our Vet Rehab Summit. This is our cool shirt. Let me cool shirt for the summit. So join us at the Vet Rehab Summit. We're going to be talking about excellence and leveling up, and really focusing on the areas that we don't address often. So this year has been so full of clinical knowledge and experience with the conferences and symposiums that have all run this year, that we decided to take a different take. So we're going to be talking about criticism, knowledge gaps, how you can grow as a professional, all the different things that are, at the end of the day, actually what's holding you back in practice. And when you get a handle on those things like imposter syndrome, that's when you're going to be able to take the next step in your business and see the results that you've been wanting to see. I don't know, you guys might relate to this, but you have a dream and you're just sitting there looking at it, no idea how to take the next step. This is going to help you do that. So join us at the Vet Rehab Summit, so that we can all kind of overcome those boundaries that are holding us back and step forward into the therapist that we are meant to be.
That's
right.
awesome.
Have a great day, everyone.
Thank you so much.
Bye.